Hello, my name is Katie Gullquist, and I am a 2009 grad from Forest Park, and I am currently a board-certified music therapist with Sweet Behavior. They're based out of Jeffersonville, Indiana, but I am contracted in Vanderburgh, Warwick, Du Bois, Spencer, Perry counties, this whole area in southwestern Indiana. So, yeah, let's jump right in. So I started playing violin when I was 4. I was a very hyper child, apparently, and so my parents put me in violin lessons so I could focus on something, and I think it worked. So I continued playing violin throughout grade school, middle school, high school, joined a youth orchestra. I joined choir and band. I played flute and band, and so music was definitely something that was around me all the time. And I knew I didn't want to stop playing music once I left high school, but I also knew I didn't want to be a music educator in the school setting. I didn't feel like I was cut out for that, and I knew I didn't want to do music performance because I didn't practice as much as I should have. So I was kind of stuck. I didn't know how I would work music into my career, and one of my friends in high school, actually, Mr. B's daughter, Mary Kate, was also looking at music therapy as an option for her. She was a senior and I was a junior, and so I decided to do some research of my own because prior to that, I was like, well, I've always liked the idea of working in the medical field, and so I was like, well, I can be a nurse. You know, we always need nurses. They're always needed. So before that, that was kind of my general plan, was to go to nursing school and maybe pick a more direct path to something. I don't know what, but so I did some research and I found out that music therapy can also be used in hospitals in the medical setting. So I was like, that's what I'm going to do. I can do music and healthcare in one, and not have to give up my music completely. And so I looked at schools, because there's not a lot of schools in the States that offer music therapy as a program. So I think last time I checked, there's like 76 or close to 80. There's probably more by now. But there were not that many to choose from. But the University of Evansville offered music therapy, and I had gone to violin workshops down there. I knew the violin professor well, and so that was a done deal for me. It was close enough to home, but not super far away. So it was good balance. And I applied there. I got in, and let me tell you, the coursework for music therapy is no joke. It's a lot. Not gonna lie, but it's doable. It's totally doable. Because you have your gen eds that all the college students take. And then you have as a music therapy major, you're a music major. So then you have all your music gen eds, like music history, music theory, that's all that's coming to mind right now. Music lit, all those classes like that. And then you have your music therapy specific classes, research methods, well, intro to music therapy, and then research methods, and all these other classes that will help you really understand how music therapy can be used in different settings. And so, in addition to all those levels of gen eds and classes, you also have to take applied lessons with your primary instrument with a professor there. And then with those lessons, you also have to do what we call workshop. So you perform a few times a semester in front of all your peers, and then you do ensembles. So you have orchestra. I was in string ensemble. There's also wind ensemble, percussion ensembles, jazz, all sorts of things, depending on what instrument you play. And then, since music therapy, you're dealing with people firsthand, you have your clinicals, your practicums every semester. And the thing I liked about UE was they started their practicum rotations your freshman year already. So the second semester of freshman year, you get to shadow an upperclassman, and toward the end of that semester, you get to lead a few different tasks and interventions for whatever population you're with. And so you can kind of get a taste of it and see if it's something you want to continue with, or if you think you need to go down a different path. So it's a very well set up program. And so you get experience in like nursing homes, special ed settings in the classroom, mental health. I did child and adult psych, and then I did hospice in the hospital, and I did same-day surgery in the hospital. So you get a wide variety of experience while you're an undergrad. And then once you finish your coursework, you do 1,000-hour internship, which is spread over 6 months. Some of them are longer, depending on how many hours a week you do your coursework or your internship. And then after that 1,000-hour internship, you take your board exam. And your board exam, your board certification expires every 5 years. So just like any healthcare professional, you have to complete continuing ed credits to keep your certification valid. So that was long-winded. So music therapy is, in a very small nutshell, using music to address non-musical skills. So I work with individuals on the Indiana Medicaid waiver that have developmental or an intellectual disability. And so a lot of the goals that I work on are communication, social interaction. We do throw some academic skills in. Attention to task, impulse control, things like that, that aren't like, learning to play an instrument, or things like, writing music, which we can work those in, but it's set toward a specific goal that's non-musical. So, okay, I wrote down a list because I wanted to make sure I didn't miss any of the big ones. So, where are music therapists needed? They can work almost anywhere. So behavioral health, in the military, in nursing homes and hospice with Alzheimer's, dementia patients, general decline, folks with Parkinson's and other movement disorders. We have forensic settings, so you could work in a prison. Mental health, medicine in general, so like in a hospital. They do a lot of pain management and lowering anxiety there. And then I have special ed classrooms. A lot of times they're contracted with schools. They're really good about that in Georgia. And then kind of a newer one that they're doing a lot of trainings on that I've noticed recently, labor and delivery. So there's music therapists in labor and delivery wards, which is pretty cool. So that is my short list. I'm sure I missed some because we go everywhere. We work with all ages. The important thing to remember about music therapy, though, just like any medicine, it doesn't work for everybody. There are contraindications, especially in like hospitals, in the NICU with babies, premature babies. They are easily overwhelmed, so you don't want to, make sounds that are too loud or for too long of a period. And so they have specific trainings on that. So that is the first one that comes to mind where you could do harm with music. So that's why doing all this training and all this education is so important. And when I was growing up, I would go play music at nursing homes or maybe in a hospital lobby, and that is amazing. We need that, but that is not music therapy. That's more like environmental music, which is still needed. It's still nice. Music is uplifting. It helps mood, but it's not music therapy, and so that's kind of a misconception about it. Let's see. How is it beneficial? I'm looking at my list here. It can lower anxiety. Let me back up. So it's been widely researched that music affects your body physiologically. So when you listen to music, different areas of your brain light up. And so that's why a lot of times folks that work with individuals that are on the autism spectrum, they're able to communicate through music because it lights up different areas of your brain at the same time, and it kind of goes through a different route that you wouldn't necessarily get if you're just speaking to somebody. So music has been proven to do that. And so it can lower your blood pressure, it can help lower anxiety, it can help you sleep better. So in hospitals especially, they use it a lot for pain control. And it doesn't work for everybody, but sometimes if you have a music therapist come in, they will need less pain meds. They might not need as much anesthesia if they're doing a general procedure of some sort. And, the less medicine, the better, usually, I would assume. And so that's very helpful in that respect. Let's see. I think I talked about, oh, another big one. How has my job changed since the pandemic has started? Yeah, so that's the last thing I'll talk about. So since I work with individuals with diagnoses of developmental and intellectual disabilities, a lot of their immune systems are compromised. And so any risks of like an outside person coming in, even if I'm not sick, you know, I could have come in contact with somebody that was, and I didn't know it. So my agency is no longer doing face-to-face sessions, and I think that's kind of what most places are doing. And so we're trying video sessions, which is totally new. And with the sound lag, it's a little bit tricky. But so I'm working from home, which is also strange because I have a toddler at home. So I try to schedule my sessions during her nap time. A lot of sessions are shorter, condensed, and I'm not able to see all my individuals because they don't have access. So we're hoping this all blows over soon and we can go back to face-to-face, but it's definitely been an adjustment. But I still do all my reports and documenting and billing all the same. It's just I'm working through a screen instead of in person. So I am over my time limit. I ramble a lot. Sorry, Mr. B. So I will end it here. But if you have any questions, Mr. B has my contact info. Feel free to email any additional questions you might have that are more specific that I didn't cover. And visit musictherapy.org if you would like to. If you're interested, they have a lot of information on there and fact sheets and things like that. So you'll learn a lot. Thanks. Bye.